Welcome everyone to the latest webinar with cosmetic laser dermatology. I am very excited to be here today with our first webinar with Dr. Zubair. He is our newest associate. He is incredible, another board certified dermatologist that was trained by the one and only Dr. Goldman. And he is just getting his webinar set up a little bit right now, which we can see all the slides. So you know, and perfect, he's going to the beginning. There we go. All right, so you are joining Lasers for Pigmentation. So in tonight's webinar, we're going to delve into the realm of all pigmentation laser treatments. So all the treatments for all the brown spots and the sun damage and all the irregularities that we don't like in our skin. He's going to walk us through all the details of the treatments, the different technologies that are available, what kind of combination treatments are available, and what's coming out in the future. And if you don't know Dr. Zubair well enough, because he's brand new, he is an amazing board certified dermatologist. We're very grateful to have him on our team. He completed his fellowship program under Dr. Mitchell Goldman at Cosmetic Laser Dermatology, and he has been doing a lot of research behind the scenes. So if you haven't seen him, it may be because he's there working on all the lasers coming out soon. But Dr. Zubair, like our other board certified dermatologists, focus on all aspects of cosmetic dermatology, from lasers to injectables to body sculpting, but he definitely has a special expertise with lasers, and especially for skin of color, which is a really big market. It's very tricky sometimes to treat skin of different colors, so it's important to go to someone that has an expertise in that. Already in his career, he's been an investigator in over 30 clinical trials. He's a peer reviewer for many of the medical journals. And we are just so happy to have him, and I hope you all get to meet him soon. So without further ado, I will hand this over to Dr. Zubair, and don't forget at the end, we have live Q&A, and then we will have our giveaway. All right, Dr. Zubair, the floor is yours.
Thank you so much, Risa. Welcome, everyone. I'm very excited for this. As Risa was saying, I love lasers and pigmentation, so these are some of my favorite topics. I also love, talking to patients and teaching. Sometimes I can get a little detailed and granular. So if that happens, if anything's a little confusing, there's a Q&A afterward, as Risa was saying. So don't hesitate to ask me some questions during that time. Right, so we're going to get started. So first I'm going to talk about what is pigmentation. I'm going to give a little bit of background on lasers too. I can't make everyone a dermatologist, but I want to make sure everyone is able to understand the differences between the lasers and make sure we all have the education we need to make, decisions about what's the best laser for us. Okay. So what is pigment, right? Well, pigment is anything that gives color. So if you think about why leaves are green, it's because they have the pigment chlorophyll. Or why is our blood red? It's because it has the pigment hemoglobin. And in our body, the brown and black types of melanin are what give our skin, our hair, and our eyes their color. Areas with more melanin are going to be darker. They're going to be more brown and black, and areas with less melanin are going to be lighter. So our skin color is determined, as we were discussing, with melanin, and people who have darker skin, we use this Fitzpatrick type scale, are going to have more melanin than people who are type 1, who have red hair, very pale skin. What does melanin do? Well, melanin absorbs light because, as we were saying, right, melanin, once it's fully processed, is brown and black. And so if you think about, if you put on a black shirt and you go out on a sunny day like today in San Diego, you're going to feel warmer than if you wore a white shirt. And that's because the dark shirt, the black shirt, is going to absorb that light, and that light gets turned into heat. And so melanin does the same thing, right? Melanin absorbs the light, the sunlight, and then why does it do that? Because it enables it to protect us. So sunlight damages our skin, and the melanin, you can kind of see it right here. It's almost like a shield. So it's absorbing that sunlight so it can't get to the other parts of our skin, the other parts of our cell. It can't mess up our DNA. Melanin is imperfect, right? It's not as good as sunscreen, but it's our body's best attempt. So it's giving us some partial protection. The less melanin you have, the more easily you're going to get a sunburn for that reason. So, if someone who had very fair skin, freckles, red hair goes out in the sun, they're going to get sunburned a lot more easily than I would, or someone who had even more melanin than me. Now, Because of that, your body is going to make melanin in response to damage. So you can see here in this little picture, this little cartoon, the sun is coming in, the sun's rays, it's causing damage, it's generating reactive oxygen species. That's just a fancy word for damage. And then these cells, the melanocytes, are making melanin because the body is saying, hey, we're getting hurt, we need to protect ourselves. And so the melanin we get is a response. So your body is attempting to reduce the damage that's happening. This photo I really like. So you might wonder what's going on with this black and white photo. That's a UV camera. So you can see here, she's got like sunspots and a little bit of red spots too. She has what we would call like photo damage, actinic damage, or sun damage. And her body has been trying to protect itself by making melanin. You could see that melanin with your naked eye, you know, just in this photograph. But when we use a UV camera, well, melanin is really, really good at absorbing UV compared to, you know, visible light, because that's the kind of light that's really damaging to our skin is ultraviolet light. And so you can see here, that's just the melanin our body's making to try to protect us. But it's also almost like a distress call from the skin. It's saying like, hey, I'm under attack and I'm doing whatever I can. All right, so let's go over the types of benign pigmented spots. So how can you tell if it's benign? Well, you need to be a dermatologist to do that, honestly. So that's the benefit of when you come to cosmetic dermatology, you get to see board certified dermatologists. So every single one of us did dermatology residency, and we were identifying and cutting out skin cancers, you know, long before we were doing, you know, cosmetic treatments and lasers. And so we're all experts in identifying, is this something that needs to be biopsied, or is this something that's just cosmetic, that's benign? And we can tell you that, and we'll know the right thing to treat and what not to treat. But we're just going to go over some of the common ones that you probably noticed on yourself, because that's going to help determine like what's the best laser to use for you. So post-inflammatory hyperpigmentation. So melanin, as we were saying, gets made in response to injury. And we were discussing the sun, but that injury doesn't always have to come from the sun. So other types of injury can also make your body produce melanin. You know, in this case, in this photo on the top here, this girl had acne, and now she's got spots that are brown in all the areas she had acne. It's very common. And then down here, you can see someone has a scar. That scar could have been, in this case, it's a surgical scar, but it could have been from a scratch, a fall, a dog bite, or anything. If you have melanin in your skin, and especially for people with skin of color, people who have more melanin in their skin, we're more likely to produce darker scars and produce pigment in response to injury. So a lentigo is the singular, lentiginous are the plural. These are also sometimes called liver spots by people. So these are produced in response to the sun, and you get them with time. You know, people often think of them as freckles, and sometimes we can use the term freckles and lentiginous interchangeably. In contrast to freckles, these happen when you're a little bit older, and we'll talk about some of the differences, but these are something that people really dislike. And this is also something that you're not going to be able to get rid of using just topical treatments, you know, just using sunscreen and topicals, although those are important, you know, like as we were talking about, even if you get something treated with the lasers or any of our other devices, you know, if you're still getting sun damage, you're still going to be getting new brown spots that we haven't treated. But even protecting yourself from the sun, once you have these, they're really hard to fade unless you're using a laser. These are freckles. You know, these you see in children in contrast to the sunspots, in contrast to the solar lentiginous. So they start early in our life. The nice thing about these, like many people don't think they're cosmetically bothersome at all. People like their freckles. That's perfectly okay. You know, I hope people who have freckles like their freckles. Some people don't like them, but they are similar. You know, they are also melanin, although they are not an increase in melanocytes, which the lentiginous are. These, you know, can fade if you avoid the sun. If you're really good about avoiding the sun, you know, people who live in more northern latitudes, so people who live in Boston and New York or travel will notice that in the wintertime, or when they're in the summer, when they're in New York or Boston, their freckles get lighter. So that's a little different than the solar lentigines, is that they will fade. But then once you're in the sun again, they do have a tendency to come back. And people also dislike when they're in the sun enough that the freckles increase in number, and then they will kind of become confluent, right? So they'll kind of almost become like connected, become like one bigger freckle. These are seborrheic keratoses. They're a little different from the other ones we talked about because these are a growth. So they can be flat, but more often they're a bump, and they're a little bit like rough and warty. People really dislike these. We start getting them in our late 30s and 40s, and then we just keep getting them. I had a wonderful attending physician who used to say, tell patients these were signs that they were getting younger. And I always thought that was very funny. But unfortunately, these are genetic. So we kind of can't stop them. We haven't figured out a way how, but we can treat them because a lot of these have melanin in them, as you can see. Even the ones without melanin, we can treat, but the ones with melanin, for sure, we'll use the lasers we describe in this presentation. And this is melasma. You know, there are a lot of different names for this condition. It tends to occur almost exclusively in women, and it tends to occur more in women who have more melanated skin, women with skin of color. It's also been called the mass of pregnancy. There are a lot of factors that contribute to melasma, including hormones, birth control, pregnancy, different medications, sun exposure, of course. So it's a very frustrating condition, especially for people who live in a sunny area like we do in San Diego, people in Florida, people in tropical areas. So it's even if when they get it better, it just comes back. So they need to be on a regimen of skin care combined with an adjunctive treatment like a laser and other systems we use. So that's another benefit, when you come to cosmetic laser dermatology, is that none of us do just one thing, is that we are trained in a broad array of treatments. So we'll know the right regimen to put you on, what kind of sunscreen to give you, what kind of melanin producing blockers to put you on, lightening agents, and what to put you on to protect you from the things that are going to stimulate you to make melanin that are going to injure your skin. This is dermal melanocytosis. So in this case, it's not just more melanin, but you have more of the melanin-making cells. This is often a birthmark. So people have this from birth, but it can become more apparent in like different times of their life. If you've ever seen on like a newborn baby, especially like a Black or South Asian, Southeast Asian, or Latino baby, they might have these like gray or blue spots. Those spots are also the same thing. They're dermal melanocytosis. People who have a nevus of Oda, as this person does, sometimes they come all the way down on the face. Those are also treatable with lasers. But the difference between this and some of the other things we talked about is this is a deeper form of pigment. So you can't really touch this at all, with the lightening agents, the topicals. This is something that's really going to need a laser to get better at all. So how do lasers treat pigment, right? Now that we know what pigment is, now that we know the different ways it can manifest, how is a laser going to fix it? So just like we were talking about that, like melanin will absorb light, lasers are light, right? They're a light that is like one specific color. So that laser is specifically chosen to be a color that's going to be well absorbed by melanin. The melanin is going to absorb the laser and it's going to heat up and break apart a little bit. And then a couple different things can happen. Either sometimes the melanin will get kind of shed from the top of your skin, because our skin is always growing and turning over and regenerating. And as it's coming up from the bottom, the skin from the top is always like getting shed. When we use a laser to damage the melanin, those melanin particles are going to come off with the rest of the skin. So it can sometimes come off with the top, and I'll show you what that looks like. Other times, if the melanin is deeper, like the deep pigmentation I was showing you a few slides ago, it can also be eaten up by your white blood cells. Our white blood cells are like the garbage men of our body. They're getting rid of all the debris, all the junk. So there's two different ways we can get rid of this. Right. And so what happens when it comes off the top? Well, you see it, right? You see these tiny little brown spots sometimes. There are different words people use from these. The medical term is MENS, which stands for microscopic epidermal necrotic debris. I don't expect anyone to remember to say that, but you can just call them, crust, or often we describe them to people as like little tiny little brown coffee grinds. Don't pick these, and believe it or not, these are actually a good thing. This is not the same as post-inflammatory hyperpigmentation. So if you get these after you get your laser, sometimes people, if they haven't been counseled, they might wonder like, oh, did I get like burned, or did I get, am I going to get PIH? And they're concerned because PIH can last a long time. It can last months or even years sometimes. But these are a sign that the laser worked and you're actually getting rid of melanin instead of making more melanin. And the more melanin you have, so if you have like my skin type compared to someone who has lighter skin, or if you have a lot of sun damage, you're going to have more mens. And patients often find that like when they first come in for their first laser treatment, they may have lots of these, but then as they do more and more treatments, they get fewer of them. And it's because there's just less melanin. You have the previous treatments worked. You just have less sun damage for us to get rid of. So this is actually a good sign. I remember at the beginning of my fellowship, which seems like an eternity ago, I was treating some of the staff members, and I was doing like the Clear and Brilliant, and I would say, how did that go? Like a day or two afterward, and say, oh, Dr. Z, I've got like mens on my face. I've got the little crust. And I would say like, oh, I'm sorry, was I like too aggressive? And they'd say like, no, it's good. And now it's like I'm optimistic when I see mens. The key thing is just you don't want to scratch or rub these off. They will come off on their own. All right, so another way we can think about lasers, I want to split it into two categories. So spot treatments and field treatments. So a field treatment is going to be something that's going to treat a whole big area, but it's not necessarily going to go as deep. So if you were to come into the dermatologist and they said like, okay, what spots do you want to treat? And you say, Dr. Z, it's my whole arm, my whole chest, or my whole face. There's not just, this specific spot. Then we're going to talk about field treatment. So they'll treat more of an area. They're not going to be as good for something like a big seborrheic keratosis that has like a lot of depth to it, right? Or the deep pigment we talked about. But they're going to be really good for like freckles, lighter lentigines, and sun damage on a large area. So the first one we're going to talk about is intense pulse light. Technically, this is not a laser. It's just an intense light. And Dr. Goldman actually invented this device. He was instrumental in the development of many of these, but he and his two partners literally invented this. So you can't get much more expertise than that. The amazing thing about IPL is it's very versatile, and honestly, a better question is what can't it do instead of what can it do? It truly gives you like a global treatment because it does a lot of different things. It's been called a photofacial treatment because like a facial, although obviously much more effective than a facial, you're treating your brown spots and you're getting red spots, but you're also getting even things that are deeper or bigger like blood vessels. So it can be used for a lot of things. Sometimes that's used inappropriately because it's so versatile. So I put on here, it is a high skill procedure, and you want to make sure you see an expert because they're very frequently, actually, it's the #1 cause of lawsuits in cosmetic dermatology that patients will go to a med spa, they'll be treated by someone who isn't a doctor or didn't have much training or expertise, and they will have been instructed to use the IPL for something it really shouldn't be used, like hair removal, or it'll be used to go over a tattoo, and then the patient will get a burn and maybe even a scar, unfortunately. Then the patient will come see us to fix it. But I just don't want that to happen to anyone. So be very careful who you see to get your IPL done. Of course, everyone in our office is an expert. We were taught by the inventors of this device themselves. There's minimal to no downtime. So that's another great thing, is that if you are working and you want to come in, you don't want to be worried about being red for too long. You don't want to be worried about having any crusting. This is a great treatment for that. You will have mens depending on how much sun damage you have, but as I said, that's a sign that it's working. Mens can also always be covered with tinted sunscreen and with makeup. This is also a very fast procedure. So if you're not like in a position where you can come in to numb for the treatment for an hour, an IPL is a great option because there's no numbing necessary. So you come in, we'll take photos, we'll treat you, and then you can get back to whatever you need to do. So a lot of great benefits to this. very impressive procedure. These are some photos we're going to go over. So this is a patient who you can see before IPL and then 2 months after. So she had some pretty diffuse brown spots. This is what I meant by like a field treatment. So if we had to go treat every little individual spot with like a tiny laser, it would take a long time. But with the IPL, you can treat all these areas broadly, right? You can really see a lot of lightening and great improvement in her skin tone. This is 2 months later. You're going to see the earliest results, like improvement within like a week or two, depending on how much sun damage you have. But for the final results, it's going to take 2 to 3 months after your last laser treatment. You know, sometimes patients with every treatment will get an improvement, but to get an optimal, like to get you where you want it, where you want to be, where you're really happy with your skin, can take multiple treatments. This is another patient 3 weeks after IPL. You can see all of these tiny spots have lightened up, even these like red spots as well. That's the real beauty of the IPL. This woman as well, she had both red spots and brown spots that were successfully treated. Her skin is like much more even now. Even though she got a tan, her skin is much more even. This patient had really intense facial erythema, really intense redness, rosacea, all through here. That was much, much better after this IPL. Another thing I wanted to talk about was the benefit of doing IPL for non-facial areas for body treatments, because IPL is excellent for the neck, the chest, and the arms. These are areas we get sun damage, but people wear sunscreen in those areas even less often than they wear it on their face. As an example here, this is a condition called poikiloderma of Savant. It's just a very fancy name to mean that the area is sun damaged. You know, it's kind of pebbly and it's got red in it, and it also has like brown in it and white in it too. So if you had to do like one single laser, it may not be the best thing, but IPL is the gold standard for treating this. IPL by itself is highly effective. There is nothing better. You know, one area that poikiloderma of Savant commonly occurs is on the chest, the décolleté. So you know, I moved here from South Florida, actually, from the Miami area. And moving from South Florida to Southern California, I have seen that even women in their 20s, you know, have sun damage in this area. So don't feel bad about it because, you know, it's an area that's angled up towards the sun. People don't wear sunscreen. It's inevitable. It's going to get some sun damage. What we should feel good about is we live in a time that we can actually treat it and improve that sun damage. And this is the results of using an IPL and an alexandrite laser to the neck and the chest. This treatment was done by Dr. Bowen. But you can see it's a very large area. Even the upper pole of the breast was affected, but it was really nicely lightened. And this was a single treatment. After like several treatments, this area is going to be homogeneous. It's going to look really nice for her. All right, so Fraxel Dual. This is another great field treatment. So what I'm showing you in this picture is that it's a fractional treatment. So if you remember from Dr. Graf's great webinar about Take 10, when we do our ablative laser, we can use fractional or we can use ablative. With the Fraxel, we're doing a fractional treatment. So the areas that aren't treated, the areas in between this grid, are going to help heal the areas that were treated. And so that means we can be a little more aggressive in the areas that were treated. So there's going to be a little bit more downtime, but it's also going to have more impressive results that way. The downtime is going to be about a week, 5 to 7 days. Your skin is going to feel to the touch a little rough, but that's not necessarily what people are going to see. What people are going to see during that time is you're going to have a little bit of peeling and you'll get those mends we talked about, a little bit of that bronzing, a little bit of that crust and damaged melanin is going to come up to the surface and be shed. So I recommend this treatment highly during the several months before an event, but not the week of the event, right? So if you are getting married, it's great to do like 6 months before, but maybe not the week of your wedding. Another amazing thing about this laser was in this year, 2023, it was published and discovered that this laser, the Fraxel, was found to reduce the risk of skin cancer, and not reduce it a little bit, like 5%. It was a 20% versus 40% difference in the people who were getting this laser versus the people who were not getting this laser. And that makes sense because this laser is pretty superficial, so it's not that deep, but it's treating that superficial layer aggressively enough that all those mutated and damaged cells from the sun are getting turned over, right? So they're getting shed, and your body is getting told, okay, we need to heal here. We need to have our stem cells produce new skin. So replacing all those cells that are kind of old and are more prone to getting skin cancers, basal cell carcinoma, squamous cell carcinoma. So definitely an amazing discovery that this laser is improving our skin, not only cosmetically and aesthetically, but also, in terms of like our risk of skin cancer, in terms of our health. This is a great example of Fraxel dual that Dr. Goldman did. You can see this patient's skin is a lot lighter and a lot more even, right? So all the sun damage here, you get quite a bit of it, and this pigmentation all throughout here on the face. The areas that get the most sun damage tend to be the forehead, the temples, the cheekbones, and these are the areas where he had the most dramatic improvement. This is a really, really great treatment. Here you can see a patient that was treated by Dr. Groff on the arms. And so similarly, even these seborrheic keratoses got better. So this is really, really nice. Gorgeous. Right, so the clear and brilliant. I sometimes think of this as like Fraxel's little sister. There's no true downtime with this. So that's the difference between this and Fraxel. It's still a fractional laser. So you're not getting downtime, and it's also healing much faster, right? You may have to have more treatment sessions. So who's deciding between this and Fraxel, right? In terms of the downtime, you'll have redness for a few hours, but there are often patients that, they leave the office and they're not red anymore. And your skin is going to be kind of rough to the touch similarly for a week or so. If you get mends, not everyone gets them. They'll be there for 2 days. So they won't be there as long. So they're really nice if you can't take any time off. You want to be able to go to work without any swelling, without anyone asking you any questions. You're planning an upcoming trip. These are all great options for that. This is the treatment you can do closer to a big event. It's also a great option for maintenance. So if you do a more intense treatment like Fraxel Dual, you do a couple of sessions of that, you can maintain it with something like an IPL or a Clear and Brilliant, because it's a lighter treatment. It's going to be less intense, less downtime, but it's going to prevent you from the sun damage you accumulated after your set of treatments. It's going to prevent that from kind of catching up and prevent you from developing those spots again. It's also a great option in any skin type, right? So even patients with a lot of melanin, patients who are like Fitzpatrick 5, Fitzpatrick 6, I have done this in every skin type. I'm saying there's no risk of PIH. I have never seen it happen, and no one in this office has seen it happen with this laser. In fact, I have actually treated PIH with this laser successfully. PIH induced by other lasers at other offices. So really amazing device. It's also the most popular staff treatment. So our staff can get to be treated with any of the devices in our office. They have seen them all. They've seen the follow-ups. They've seen the results. This is very popular with them because it's no downtime. It's something they can get done at the end of their workday. It's something they can get done during lunch, and they can go right back to working without any issue. So those are kind of the pros and cons, but it's often, I think, a laser that's helpful to think about as somewhat similar to Fraxel, a little bit different. Right, so let's look at some results from the Clear and Brilliant. So this is the patient that was treated by Dr. Bowen. You can see not only did she have a lot more brightening and radiance on the entirety of her face, but even these spots are lighter. So this was a really impressive result, because some of these are some pretty sharply bordered lentigines, over here and here, and some of these are not even visible at all anymore. This treatment, I'm sure this result require more sessions. But this is a patient who's Asian. This patient has skin of color. So using the Clear and Brilliant, Dr. Bowen was able to treat her without any risk of PIH confidently, and quite effectively, as we can see. This is a patient who's a Fitzpatrick type 5. She had a lot of PIH here, right? This is from acne that we were discussing, and this is cleared up really nicely. Her skin tone is much more even here. So this is a really, really beautiful result. And you can see, this is the tricky thing, and the whole key about treating skin of color is that, there's more background melanin, because it's easy to treat, right, a spot if the spot was really dark and the surrounding area was really light. then you know that laser is just getting absorbed by the spot. But when they're closer together in color, like let's say like these spots here, how can you effectively, make sure the melanin gets absorbed by the spot, but there's not enough energy that melanin starts to get lightened in the area of her normal skin, right? And to do that, it's not something I can summarize in one slide. That takes a lot of experience and that takes a lot of knowledge. And when you see, a board certified dermatologist, when you come to cosmetic laser dermatology, we'll never have like a technician or someone who's not a dermatologist treat you with these lasers. So we're using the laser, we're looking at the reaction on the skin, we're seeing how much is it lightening, is the reaction too little, is it too much, and we're adjusting those settings. Sometimes I lecture to other doctors, both through ASDS and for specific companies about how to use these devices. And often like the question you get is like, what setting should I use with this device? And it's not that straightforward or simple an answer. It's a matter of knowing that patient's skin and knowing the device. These are some other results. As I mentioned, this is something that is gentle, so you can combine it with other treatments. The clear and brilliant can often be combined with IPL. That way the IPL is going to be really great at getting, the red spots in addition to the brown spots, and then you're using the clear and brilliant to kind of clean up the rest of the brown spots. Here, it was combined with V-Beam, which is a treatment for red spots, Alex, which we're going to talk about later, and then the clear and brilliant is treating the diffuse light spots. But basically, Alex is one of those lasers we're going to talk about in just 1 second that's going to target these more discrete brown spots, and then clear and brilliant is getting all these lighter ones. And that's also, something when you come to a place that doesn't just have a few lasers, we have 60 different devices, and the only reason we don't have more is that we get rid of the ones that we think aren't as good as the other ones. So we have the full range of options to choose exactly the tool we need. It's like the saying that says, when all you have a hammer, everything is a nail. I mean, we have the entire spectrum of things here. So we see the lesion for what it is. We look at your skin type and we can say, okay, what's the best option here? Or what's the best combination of options? So let's talk now about those targeted lasers that are going to treat like a specific spot. So if you come in and you say like, okay, well, I have this one spot or these like 5 spots or any number, but there's specific spots that bother me. And it's not, a diffuse area, or maybe those spots are a little bit thicker and a little bit deeper, then the lasers we're going to talk about now are going to be the best thing for that. So the Q-switch Alexandrite laser. So Dr. Goldman also helped develop this device. This is ideal for lighter skin types. It's very powerful. This is also an excellent option for SKs and the lentiginous that are kind of even darker or deeper and have even more melanin in them. So this is like a big gun is the way I would describe it, a very powerful laser. Patients love it and doctors love it because it is a very satisfying procedure to do. In front of our very eyes, this laser and the next one, it will lighten the lesion. So it's not just that, you treat it and you see some redness and then, in like a little while, you'll see the pigment go away. This is something that in front of you, the second you fire the laser, it's going to get lighter. You're watching that melanin get broken apart. That's what this little diagram is showing. One of the ways that lasers are selective and the way that they're targeted and the whole beauty of them is that by choosing the laser that is the right color, we can be careful about, okay, are we targeting a red spot? Are we targeting a brown spot? Are we targeting wrinkles? Are we targeting tightening? The other way we can control that is how fast that laser is, the pulse duration. So is the laser firing that pulse like this, or is it like beep, kind of a longer duration pulse? And for melanin is very small, and anything that's very small is going to cool off really fast. So if you imagine, for example, like a little 6-year-old child who's at like, I don't know, an amusement park, they're at Disneyland and it's a hot day, their sweat is going to be able to help them cool off very quickly. In contrast, if you think about someone who's, say like an NFL player, right? And he's at that same theme park on the same day, right? He's a big person, he's a lot of volume and he's bigger. So it's going to be hard for his body to get rid of that heat. So because melanin is small and is so good at getting rid of heat, it's going to pass that heat onto the surrounding skin. And we don't want that. We want the melanin to get damaged and the melanin to get destroyed. So to do that, we have to heat it up and put energy into it faster than it can cool off. And that was the amazing thing about the Q-switch laser's development, is that it can deliver that laser in nanoseconds. So what this is showing is that you're absorbing it fast enough that the heat energy is getting locked into the melanin, and it's not getting passed off onto the surrounding tissue. It is going to have a little bit of downtime. It's going to be different than kind of the the field treatments we talked about, because it's only going to be downtime on the little spots that got hit by the laser. They're going to become a little bit crusted, and they're going to flake off in 1 to 2 weeks. But that's also like a sign that you know that that spot is gone, right? That is visibly the spot disappearing in front of you. This is something that can be used in a combination. So we often combine those field treatments with the spot treatments, right? Just like I was talking about with the Clear and Brilliant, and the IPL and the Alexandrite. If you have both, like you have sun damage, so you have a lot of like diffuse, lighter, spot areas that are like melanated, a lot of lentigines, but you also have like some SKs, maybe you have a few lentigines that are more intense, then we may use a combination of treatments to effectively get you the best results. Lastly, this is also used in the Take 10. So if you've seen the results from the Take 10, the spots that are more, as we were saying, like deeper or a little more melanated or a little tougher to get just with one laser alone, we'll use the Alexandrite laser to really make sure we get those spots. We're going to look at some amazing results here. This is an example of the combinations we were talking about. The hands are an area after we treat our face, that people can kind of notice our age a little bit, and we can become a little self-conscious about. The tops of the hands are in the sun all the time. And, those are areas we get the same things. We get lentigines, we get seborrheic keratoses, we get sun damage, we get skin cancer. So here we're combining a treatment, Alexandrite and Fraxel, to treat both like the intense spots like this one for the Alex, and then also just the overall like lighter spots like here and here and here. This is just 1 month after that treatment. It's already much lighter. So all the spots that got hit with the Alexandrite have flaked off by this point, and the spots that were treated with the dual are better, but they're actually going to continue to get better. That's what some of these later photos are going to show. So this is 4 months afterward. Different patient, but you can see here the hand is a lot lighter because like over the course of 2 to 3 months, more and more of that pigment is getting shed. So very impressive result here. And even you can see this spot is pretty large, pretty substantial, as are all of these. And it cleared very effectively with the Alexandrite. This is an amazing result. So these spots are SKs. These are seborrheic keratoses. These are pretty big. Not only, do people dislike how they look, but when they're in this area, they start to catch on the bra line. People can feel them rubbing. They can become itchy. And the Alexandrite is a great option to effectively treat this. If you see a general dermatologist, the treatment of these isn't covered by insurance, but sometimes dermatologists will treat these using liquid nitrogen. They're using a cryo gun, or they'll use a hyfricator, which is an electrosurgical unit, to just kind of burn it off. But those treatments are not that precise. So they will get rid of it, depending on how aggressive the doctor is. But there's a higher risk of changing your natural color, of hyperpigmentation, hypopigmentation, and even causing like a scar or worse injury. So that's the beauty of the laser, is you can see, right, these are dark spots compared to the surrounding normal skin color. And so that's what the laser can take advantage of. And this is incredible clearance. Really, really impressive. And this was one treatment. This is an abdomen. So same thing. These are little seborrheic keratoses. This is an area that probably doesn't get that much sun, but in the case of seborrheic keratoses, they're genetic. So even in areas that don't get any sunlight, those of us who are destined to get them are just going to keep getting them. But thankfully, we have something that can treat them really nicely, effectively, and precisely with a minimal risk of any complications. So really amazing treatment here. Like the number of spots here compared to here, this was a really incredible result. Right, this is another patient who had a combination treatment. Dr. Bowen treated this patient with Fraxel Dual and with the Q-switch alexandrite lasers. This is 2 treatments. So again, this is an example of here she's using the Q-switch alexandrite for spots like this one and this one, which are like more like seborrheic keratoses. And then the Fraxel Dual is kind of what accomplished the overall increase in brightness and radiance and treating this like background sun damage. Really, really nice. Right, same thing here. This is a patient that was treated with that combination. You'll also note that a lot of these patients that were selected have skin of color. These are patients who are Asian, African, Latino descent, and these lasers were used safely and effectively, right? So 2 months later, this patient doesn't have any PIH, and all of these spots got lightened from below the eyes, the cheekbones, down to the chin. She actually had some acne here too, that, you know, the PIH, like this lesion here, these got a lot lighter. So really amazing in a Fitzpatrick type 3 patient. Same thing, a similar patient from another side. Here you can see like these spots, there is no way these spots are gonna get to this stage using just sunscreen or lightning. Those are essential to use in combination with these devices, but to get to here, you're going to have to use a device that is going to better be able to target that melanin. You can see the result is really impressive on both sides of her cheeks here. That's excellent. Here too, this is the other side of her face. Yeah, similarly, she had some discrete lesions. They're really sharply bordered along her cheekbone. It's an area that gets a lot of sun, so it is very hard to treat, you know, without it coming back, without it getting worse. But a couple of sessions of Fraxel Dual alexandrite with time, combining it with sunscreen and a good skincare regimen, you can lighten these a lot. All right, so the last laser we're going to talk about, Pico. This is one of my favorite lasers. This is safe in all skin types. So we were talking about how the speed of lasers was the development. Well, 10 years ago, they developed, you know, the picosecond lasers, or I should say, they made them small enough to put in an office, because before they were the size of an entire laboratory. Because these devices, to deliver energy that fast, it's energy being delivered in 1 trillionth of a second. That's why they're called pico, it's for picosecond. It takes the power of a nuclear power plant. You know, a power plant will generate gigawatts of power. It's the same thing with this picosecond laser. It's generating a gigawatt of power in obviously a much shorter amount of time. So that's what enables it to do what you're seeing here, that not only is it not the energy not getting diffused, the heat getting diffused to the surrounding area, but the energy is coming in so fast that it's breaking that melanin apart. So it's like shattering it, you know, and cracking it instead of putting heat into it. And that's what makes it even safer for other skin types, for higher Fitzpatrick skin types, for patients who are of Black, Latino, Asian descent, that without the heat, there's just much less risk of post-inflammatory hyperpigmentation. So it's an amazing treatment for that reason. Very minimal downtime. You know, you may have redness for a day or two, possible to get some crusting sometimes, depending on how aggressive the treatment is, and it's very effective for both spots, and then even you can use this as a diffuse treatment if you use the fractional version of it. So that's the other great thing, is we can use the picosecond to treat some discrete spots, and then we can switch it to the fractional handpiece to treat like a more diffuse area on your face. In fact, Dr. Loyal wrote a study that we conducted that Dr. Ishii and I performed on patients. We were using the fractional version of the picosecond lasers. Patients were extremely happy with the results. Really great treatment. So let's take a look at some before and afters. So as we were talking about, this is a patient who's like a Fitzpatrick type 5. It could be very tricky to treat with some lasers, but the picosecond lasers were able to treat this beautifully. Dr. Bowen treated this patient using PicoWay and PicoSure. That's another thing, was that we have both those devices. We actually used to have 3 Pico devices, but one of them we felt like was superfluous, so we only kept the best 2. And both like this deeper pigment, which you can see here, which is kind of bluish, and these like lighter spots, these are like PIH, both of these got better. So really effective. This is a patient who had melasma. Melasma is very tricky to treat, right? Because it's caused by a lot of things contribute to it, and heat from a laser, from a device, can make melasma worse. So you want a laser that's really, really safe in all skin types. Picosecond lasers are great for this kind of condition. So this is a patient Dr. Wu treated. This melasma is much lighter. It's much more difficult to see. This patient had a great result. So it's very impressive. This was a scar and a PIH that Dr. Wu treated with the picosecond lasers. As I was talking about, not just from the sun, but any kind of injury can cause pigmentation and the production of melanin in people with skin of color. I myself have a scar that is brown from my body trying to protect itself, and these can be effectively treated with pico. This was a single treatment, and you can see that it was in a somewhat sensitive area, right? It's right between the patient's eyes, but we were able to safely treat it, one treatment with minimal risk. This is the last before and after we're going to show. So this is a patient. This type of lesion is the same thing that I was mentioning, that it's quite difficult to get with just topicals, virtually impossible. And this is a patient who's like a Fitzpatrick type 4, but really nicely we were able to make the skin more even using the picosecond laser. All right, that's our presentation. So I'm going to be answering any questions you have.
Perfect timing. That was, wow. I can't believe how much information you crammed into there. If anyone missed anything, this is recorded and we will send you the recording. You can watch that again, but it's so awesome to hear you talk through the before and after photos. It's one thing to see it. It's great to hear you say that. So as Dr. Zubair said, this is the time for question and answer. So if you have any questions, use the little Q&A feature down here. We have a couple already that I will start with. All right, so how do you determine which laser to use for a patient with skin of color, IPL versus clear and brilliant?
That's a great question. So in the case of IPL and clear and brilliant, you might not actually have to choose. You could actually use both those devices. IPL is something you'd have to be more careful about. And in fact, that's like the situation I was describing, where often at like a med spa, you will see the case that a patient got a burn. It's often the case that it was someone with skin of color who went to get laser hair removal, and then, that device is not the best thing to use for that. In our office, when we use laser hair removal, we use an ND-YAG laser, an alexandrite laser. How do I choose? So in some skin types, I would just avoid using the IPL because there are better lasers for pigmentation for that reason. Like if I had a patient who was Fitzpatrick type 1 or 2, yes, I'd say let's say the patient was coming in for red spots and brown spots. I'd say, let's use the IPL because it's going to hit both those things. If you were a Fitzpatrick type 5 or type 6, I might lean more toward using, let's say, for the brown spots, something like the clear and brilliant. And for the red spots, I would use like a V-beam. So red spots, I didn't talk about much in this webinar. So we'll do another webinar for that because that's a whole beast in itself. There's a lot of great lasers we have for that.
That's so helpful. So this is a great question. Once a patient obtains their desired results with these personalized treatments, what does maintenance look like to keep the outcome, especially if they have acne-prone skin and they're a skin of color patient that's prone to PIH?
That's an excellent question. It's great that you asked that question. I like the way you're thinking. So if people often ask, like, how long is a treatment going to take? Or sorry, how long is a treatment going to last? Like, how long is the result going to last? And it's a tricky question. I think a good way to think about it is I often tell people, if I could freeze you after I treated you and keep you like in suspended animation in the office, this treatment would last forever. But the reality is we all have lives to live and we're all going to be in the sun. We're going to be outdoors. We're going to continue to age. So you're going to get new spots. And that's what maintenance is all about. So how long a treatment lasts depends on that. In the case of acne, I absolutely counsel patients that if we're treating PIH, if we're treating acne scars, that we have to address the acne first. Otherwise, or we can address it at the same time, but we have to address it somehow. Otherwise, you're going to keep getting new acne and you're going to get new PIH and new scars. Now, we will treat it if you ask, but we would strongly advise that you also treat your acne at the same time. We do treat acne in our office. We treat it medically. We actually have lasers that can treat acne now. That's a new development. It's very impressive and it's very exciting from a dermatologic and device standpoint. But maintenance, to answer your question more directly, in someone like that is going to include wearing sunscreen, continuing your acne treatment, whether that's topical, oral, or device-based, and it's going to be using a skin regimen, something like a vitamin C serum to protect you from, sun damage, pollutants during the daytime. It's going to be using things like the many tranexamic acid products out there that are going to prevent, that melanin from getting produced in response to injury. So there's a lot of different elements to it, but it's going to be a combination of things. And then lastly, as I was saying, the devices are, like you might downgrade. Let's say we did something like for your PIH, we did a Fraxel dual, or let's say we did a picosecond laser, and we did a series of treatments, and you got to a place where you're happy with your PIH. Then we might say, okay, you're going to do the skin regimen, and then you might only get like a clear and brilliant Permea, let's say once every 6 months or once every year. And it's going to be just a much less intense treatment, no downtime, and a much less costly treatment, and also less frequent for that maintenance.
Yeah, absolutely. We sometimes tell patients kind of like your teeth cleaning every 6 months. You come in and get these every 6 months.
Yeah, it's a great analogy.
All right. Well, we have a lot of questions. We'll get through as many as we can. So this is interesting. I had great results with Clear and Brilliant. Does that automatically mean I'll be a good candidate for Fraxel? And does Fraxel have other benefits like increasing collagen?
That's a great question. So something I should mention is that both the Fraxel and the Clear and Brilliant are actually two different lasers in one. So both of them have each of them have an aspect that is better at treating pigmentation, which is what I talked about on this presentation. And then both of them also have a setting which will go kind of deeper. So yes, actually those devices can treat collagen, and they can improve like your skin texture. So they can improve like scarring, they can improve wrinkling, they can tighten, they can improve pore size, is the word I was looking for. So yes, they can also treat collagen, but like your doctor is going to choose which of those is going to be best for your concern. So if both of those things concern you, which of course, like we all want to grow collagen in addition to treating our pigmentation, your physician may say like, okay, we're going to first do, let's say, Fraxel Dual, and then we'll do the Fraxel Restore, or we'll do Clear and Brilliant Permea, and we'll do the original Clear and Brilliant. So yes, those devices can do both of those things. And if you do like the Fraxels that target collagen, they will have some benefit for pigmentation, but it's not what we would recommend, because we just have, because we have so many devices, we have like the best thing for every problem. So like we would say like, well, this is going to be the best for that. So we wouldn't recommend you something that's going to be suboptimal. But that is a place, where I discuss like the IPL, because if you did something like IPL and Clear and Brilliant, that's often done in our office, you're going to get benefits for a whole range of things, from collagen to pigmentation. Now, if you benefited from Clear and Brilliant, as you're saying, and you're saying like, would I also benefit from a Fraxel? Potentially, yes, but it all depends on like how that Fraxel is done, right? Because if the Fraxel is more aggressive, so if someone did the Fraxel at a overly aggressive setting, you could get PIH, and you would be very unhappy with that. But we can also reduce the power on the Fraxel, and we can kind of look at your skin type, look at, the doctors here are so experienced, we treated so many patients, that we have a very good idea, honestly, from the beginning, that your skin type and your pigment, what kind of settings we're going to need. So not always, basically, but yes, there's a good possibility.
And luckily, that's why we have both lasers, so you don't have to decide right now. Oh, they said thank you so much. That really was helpful. So do any of these laser treatments help with milia or syringoma or broken capillaries?
Great question. So syringomas, what is a syringoma? So syringoma is a growth of the sweat gland that's a little bit abnormal, and it appears like often as like little bumps underneath your eyes. We don't have a laser yet that's like really precise at targeting them, but the best option is to use one of the ablative lasers. What were the other conditions you were mentioning? Syringoma, milia. Oh, milia,
yes.
yeah. So for milia are basically like tiny little cysts in your skin. Milia are best treated by extraction. So we have a great esthetician actually in our office, Farzanet, who performs that. And she's just going to know how to gently like get that little bit of cyst, that little bit of keratin out of your skin without causing any injury, because if you try to do it at home yourself, that's often how people will give themselves like a tiny little bloody spot. So don't try it at home. Just come in and we will do it for you. But no, the lasers we talked about aren't really the best for treating miliary syringomas, because these lasers we talked about target melanin, or they help your melanin get shed. And so for syringomas, milia, there's just going to be other things that are better.
Okay. All right, guys, last question, and then I'm so happy that we have so many questions today. But we just don't have time. I want to be respectful for you guys for the end time. But what I will say is Dr. Zubair offers complimentary consultations. And as you can tell, he is a wealth of knowledge. So I don't see why anyone shouldn't sign up for a complimentary consultation, at the very least, to kind of have him give you an assessment and a potential treatment plan. Especially if you have skin of color and you're looking for someone that's kind of an expert in that area. But here's some kind words. One person said, I learned so much and greatly appreciate how well you described all the techniques.
That's the greatest reward, when people feel like they learned a lot.
Yeah, I think a lot of people learned a lot. I learned a lot during this webinar, and I've done so many of these. So thank you.
That's saying a lot, Risa.
Okay, last quick question. Do any of the lasers that you talked about help with scars, not discoloration, but like the scar depth? Or would those be different lasers?
Good question. That is a great question. So I was thinking about how detailed I want to be about this. So a scar is, yes. Okay. So we got to make it quick. So a scar is like collagen that's somewhat disorganized. It's not the way we want it to be. And so actually a lot of different lasers will stimulate your body to restart the healing process and change it and make it improve. These lasers will help the brownness and help the color, but we have a lot of other lasers that are much, much better for improving a scar. And it's going to depend on, is the scar too light? Is it too dark? Is it like a dip? Is it atrophic, or is it a bump? Is it too tall? So we have a lot of different lasers, and like better for scars are going to be things like radio frequency microneedling, the ablative lasers, the Fraxel Restore. All of those are really great treatments, but these lasers, they could improve it, and they will definitely improve the brownness of the scar, but not the thickness, not the depth.
All right. That was so great. So we have, I wish we could just get to all these questions, but look, if you guys liked this, let us know, share on our Instagram or in the office, because we can do more. We can do this. We can do, live ones on Instagram. We can do more webinars. Maybe we just even need a webinar with just open question and answer with Dr. Zubair. What do you guys think?
Yeah, you know what? Maybe we can actually take some of the question and answers, and I can answer them on Instagram in the future.
That is a great idea. Perfect. So let's make sure you guys all follow us on Instagram at Cosmetic Laser Dermatology. And we have a really big giveaway, which I'm so excited about. Everyone is a winner because you all get complimentary consultations, but 3 of you are going to get $1,000 towards one of these amazing laser treatment packages. So I am popping all of your names, all of you that stay till the end, into something right now, and we will notify you tomorrow if you are the winner, just to keep your privacy. So congratulations in advance to whoever's going to win. But the truth is, thank you, Dr. Zubair, so much for spending the time. I know you had a full day of seeing patients and doing procedures, and it's late, and we appreciate you coming and sharing so much knowledge with all of us.
Can you enter me in the contest, or?
I know, right?
All right, thank you so much, Risa. Take care. Thank you, everyone, for attending.
Yeah, you guys, we hope to see you in the practice soon, and come meet Dr. Zubair if you haven't met him yet. Bye.